Hi, my name is Ken Williams, and I'll be speaking about the Pavlovian conditioning article. All right, Pavlovian conditioning, also known as classical conditioning, was discovered in the early 1900s by physiologist Ivan P. Pavlov. A Pavlovian condition is theorized that psychologically significant events are associated with neutral stimuli. That psychological, emotional, and behavioral response systems are evoked by familiarity, which prepare organisms for significant events. The article indicates that death due to drug use can occur simply due to a person being in an unaccustomed environment. The research presented in this article suggests that case studies have shown people use the same quality and quantity of heroin with no complications until they use in an unfamiliar environment. Pavlovian conditioning indicates that tolerance to substance abuse can be situation specific, and this information is valid in the public health sense and can potentially determine life and death of someone battling substance abuse. So this article is based off a young man named KJ and his wife. Both were addicted to heroin. And just like many others, they were in and out of treatment trying to find sobriety and was unable to do so. And KJ ended up skipping work one day and going to buy heroin with some coworkers, and he used in a public restroom. Now this is different from where he normally uses, according or indicated by the article. He probably typically used in a familiar environment like his home or somewhere where he is accustomed to using. But in this particular day, he used in an unfamiliar environment. The article states that the quality and the quantity of his substance was no different than what he normally uses. And there was no impact on his, as far as dire impact on his co-workers. But KJ ended up overdosing and dying, though his quantity and his quality was no different. And so the article indicates that the reason why KJ died is because his natural organisms were unprepared to respond to his drug use that day because he was not in a familiar environment. And so this was the implications of his death. And so we want to look at kind of what are the implications of the article. How does KJ's death relate to what the Pavlovian conditioning is saying about being in a familiar environment and having your neutral stimuli activated by that familiar environment? And how does the Pavlovian conditioning work as far how do we fit the two together? And so first we have to look at what is Pavlovian conditioning and what was the research done? How did this theory come about? So let's break down Pavlovian conditioning theory. So let's say we have a dog and you place a steak in front of the dog. The steak causes the dog to salivate. All right, the steak is an unconditional stimuli. The dog salivating is an unconditional response. The steak is in front of the dog. It causes the dog to salivate. So he has a unconditional response, meaning a natural response, an uncontrolled response, something that he doesn't have to work toward doing. All right, so I put the steak in front of the dog every week and he's salivating to the steak. The steak is his unconditional stimuli, and his unconditional response is to salivate to the steak. All right, so the second week, instead of putting the steak directly in front of the dog, I ring a bell before I put the steak. Now, when he first hears the bell, he will have no reaction to the bell. All right, this is called neutral stimuli. He has no reaction to it. It's just there. He may look up to it, but it doesn't cause him to salivate until the steak gets down. The steak is causing him to salivate. But I do this for 2 weeks. 2 weeks before I lay the steak down, I ring the bell. And as the dog begins to be conditioned to the bell, knowing that first I hear the bell, then I know that the steak coming, slowly but surely the dog's brain will be trained to salivate to the bell. And the bell becomes the unconditional stimuli because the dog is conditioned to know that when the bell rings, the steak comes right after. Now the dog also starts to consider these other factors, okay? So let's say that I have a certain time in which I ring the bell. There's a certain environment. The dog is home, he's in our home. I ring the bell and then I lay the steak. And the dog knows that if we're out and about during the day and he hears a bell, it's not going to trigger a stimuli because his mind has been conditioned. I'm accustomed to being at home. I'm accustomed to hearing the bell. And then after that, the steak comes. So the dog ultimately starts to correlate the environment. He starts to correlate the bell. And then he understands that with that comes the steak. And so his mind is conditioned to the environment, and the environment and the bell precedes the stimuli. And so what happens is that if he's in an unfamiliar environment and he hears a bell, it won't most likely trigger his stimuli because he's accustomed to being in a certain place when his stimuli is triggered. And so when we look at KJ's story, even though the heroin started out to be the neutral stimuli for him, and his natural response triggered in once he used it, ultimately, slowly but surely, and this can happen subconsciously in our minds, that slowly but surely the mind and the organisms become conditioned to the environment, become conditioned to the familiarity, the comfort of the environment. Now, when he uses prior to going to work and using in a public restroom, it may be tough to trigger response because now you're in a public restroom, you have to go to work, anybody could walk in, you can face going to jail or all type of things. And so it can impact the triggering of the natural response or the unconditional response. And so this is kind of the theory of having the natural response in the organisms work as a custom because he's in a custom environment. His brain has been trained to be in a certain environment at a certain time, in a certain place, in certain comfort when he takes in the substance. And this time he was not in a comfortable environment. He was not at a usual time, a usual place, around usual people. So his comfort level was not there. And by using it did not trigger his natural unconditional response, which ultimately, based on the theory, from my understanding, resulted in his death. So understanding this information, what practical advice, if I was a healthcare professional or a counselor therapist, would I give to a client or patient? First, I would be very, very clear in the language that I use. I would make it clear that this theory is not a green light to use illicit drugs or heroin. It wouldn't be a green light for you to use as long as you're in a custom, comfortable environment or familiar environment. Because again, this is a theory. Because you're in an environment that's comfortable, it can still result in overdose. It can still result in death. It can result because I don't believe that they had any information on the actual substance that he used. And so you can get a bad batch of something, your internal organs can fail, all type of things can result in death. So this is not something that said that this is a green light for a patient or a client to use as long as they're in a familiar environment. I would say that this is something to consider as far as for their own safety and health, and it lowers the chances potentially of their natural stimuli not responding. And so I would provide the information mainly for relapse purposes. Again, relapse drug addiction is a constant battle. It is a brain disease. It's a disease where the brain and the body are fighting against this disease, and it can be very, very difficult to find sobriety. And so during the period of trying to find sobriety and in that recovery period, and even after going through the period with the withdrawals gone, it's still a psychological battle when a patient is dealing with substance abuse. And so they may go through periods in their life where they relapse on a regular basis. And so if a relapse incident happens, it's best that they have this information that studies show that there's a potential that using in a familiar place could lower the risk of overdose. And so having that information and sharing that with the client or patient is very vital. And so I would make it clear as far as it's not a green light to use. You still could face the same risk. You still can face impending death. You can face all those things. This doesn't take those things off the board. There's still a lot of risk involved. But if we can find a way to lower the risk, when you're going through your ups and downs and you may have relapsed or something, like if we can lower the risk, if this is a potential of lowering the risk, then it's definitely something that I believe should be shared with patients and clients to inform them while they're in this battle for sobriety and recovery, that they have this information to best protect themselves and lower the chance of death by overdose when using substances. So in conclusion, I think that Pavlovian conditioning, classical conditioning, is very, very beneficial also when it comes to prevention and treatment. Being in a comfortable environment really has its benefits. And that's with treating. When someone is prescribed medications for pains or things like that, knowing that they have a better chance psychologically, mentally, physically, emotionally, to recover, to use things correctly, and also to be able to fight the withdrawals and be able to fight the psychological, mental stronghold that addiction has. I think being in a comfortable environment provides a better chance of success when it comes to treating substance abuse. And so I think that when we look on the other spectrum of it, of the benefits of being in a comfortable environment and Pavlovian conditioning outside of using substances in a comfortable environment or a familiar environment, but also treating patients in a familiar environment. That's why I'm a big fan of in-home services, where a provider can go into a client, a patient's home and treat them there. If you see a lot of senior citizens who are dealing with a lot of health problems, they tend to have a longer survival rate when they have people at home, or if they have their children taking care of them and looking out for them versus being in facility. And so I think that when we look at treatment can be very, very beneficial and very effective if folks are treated in a familiar environment. And so that's kind of some of the things that I also took from this article. And so as moving forward in my pursuit of a degree in psychology, and also potentially being in a place where I can counsel and provide therapy for individuals who are struggling with substance abuse. Taking both sides of the spectrum of going through those relapse periods where you are having those up and downs and those battles, and you find a time where you use, giving that information that, hey, we can lower, let's potentially see if we can lower the chance of death by overdose by, if it has to happen, here's the information of using in a safe or familiar environment, but also being treated in a familiar, safe, comfortable environment. Will that give the client and patient a better chance of success versus going to a facility, which are needed also? But going to it, because sometimes you have to pull a client away from the environment that where the drugs are, where they're easily accessible. I completely understand that. But putting them in a place where they're comfortable around people that they're comfortable with, family, and treating them in a familiar environment, will that provide another or a higher success rate versus the relapse rate, which is very high? Can we bring that down and have a higher success rate in treatment if we use Pavlovian conditioning in that sense? Thank you for listening to me. I'm Ken Williams, and this was my take on the article Pavlovian Conditioning, and attached is the script and the essay that I wrote pertaining to this article. Thank you.